bone and joint health. I think that this is something we commonly start to worry about when it becomes a problem. And so I thought it would be a really good thing to discuss some of the preventative measures that we can be taking to help improve our bone and joint health. So that's really what we're going to be diving into today. I know that Carol mentioned briefly there, in regards to lifestyle medical centers and our services, we have lots of different things that we help with, including women and men who are struggling with issues like bone and joint health. So if you guys have been thinking about making an appointment and reaching out to our office to kind of learn a little bit more about what we can offer, I definitely encourage you to do that today. All right, well, let's get started. So I thought the first thing that we would talk about is just some general changes to muscle, bone, and joints as we age. And although everyone kind of goes through some of these changes at different time frames, a lot of us are starting to notice changes in our early 30s and definitely into our 40s. So, things like muscle fiber shrinking in size, our muscle tissue is replaced at a slower rate. We have reduced muscle tone. There's bone wastage just due to inactivity in general. So, there's lots of other reasons here. Hormonal changes is an example as well. Specifically there, I just gave an example of women who are going through menopause. That's a very common time due to loss of minerals in bone tissues. A decrease in estrogen can also play a role in our bone health and our muscle mass. And so we lose calcium as we age. We also have less lubricating fluid that is existing in our joints. This results in just a thinner cartilage and just overall less support, more likely to have injury and things of that nature. We also have looser, shorter ligaments, and this can create just in general less flexibility and overall stiffer joints. So it's why we're kind of, holding our back. We're having a hard time from sit to stand. These are some of the things that are happening in our body during, like I said, as early as our 30s. And, I think it's good to really understand what's actually happening. I think there's a lot of power to understanding that. So some common problems that are associated with bone, joint, and muscle changes. I know you guys have probably heard of some of the things that are on this page, of course, but sometimes it's nice to just know what's actually happening if we have that, or what does it really mean to have osteomalacia or osteoarthritis. I do have a picture there to the right. You can see the right side is that osteoporotic bone, and then the left side is that healthy bone. And what you're seeing here is just on the left, there's a healthy bone. It's really dense, which equals it being a lot stronger. There's less gaps. It's just more tight-knitted, little honeycomb style picture there you're seeing. And on the right, you're seeing larger holes, larger gaps. There's also a thinner outer shell of that bone. And that's what's kind of happening to our bones specifically with osteoporosis. But to go over everything here, so I've put there first osteoarthritis. This is when we have cartilage in our joints that's starting to break down. This is kind of the start of that osteoarthritis. Osteoporosis is when bones lose mass and become brittle. Osteomalacia is when we just have a softening of the bones. Sometimes that's a result of problems with vitamin D metabolism. Rheumatoid arthritis, this is an inflammatory response, inflammation in the joints specifically, which can cause a lot of pain, decreased mobility. Just some general muscle weakness, pain, due to what I just mentioned above, conditions that basically lead to reduced activity. And as well, a reduced range of motion as a result of some of the problems that I just mentioned. And then there's also an increased risk of injury. So we've got changes that starting to occur with our gait, the way that we walk, hold ourselves up, move, our balance, and our stability. So there's definitely things that we have control over. I tell people this all of the time. Let's focus on that. We have lots of things in our life that happen that we don't have a lot of control over, and there might be issues related to your bone, joint, and muscle health that you do not have control over. I highly encourage you guys to be going to your annual follow-ups with your physician to discuss this kind of stuff. We'll talk about a little bit of that at the end, things that they can look for to help guide you in which direction that you need to go. But luckily, there's a lot of things that you can do to help with that prevention and help relieve some of the symptoms and create maybe less damage. So let's talk about that. So we're going to talk about preventative measures that we can take for optimal bone and joint health. So of course, we're going to talk about some dietary changes here. So, diet is very important with lots of things. And I think it can get very overwhelming when we start to focus on, something really specific like this. I tell people to just look at the bigger picture, right? So we talk about the big picture a lot. So we've got meal plans and we have simple approaches to the way in which you eat. And I think that that's really helpful mentally for people. But I am going to get really specific with some of these vitamins and minerals, and then we'll start to talk about some of the macronutrients. But it's always about just taking one little piece of it at a time and trying to figure out, what your barriers are and working on, developing that bigger picture. So as you can imagine, calcium is very important with bone health. Calcium is crucial for bone strength and its density. Lots of different ways to get calcium in. We're going to talk about here next, guys, the sources that you can get in your diet to meet some of these requirements. But your needs for calcium do go up when you become, for women, postmenopausal and just older adults. So that's something to take into consideration. Vitamin D. Vitamin D is very helpful with your ability to absorb calcium. So there's a certain minimal requirement there that I've mentioned, and maybe you've heard this before, between 600 to 800 IUs or international units per day. And then maybe some of you have literally never seen some of these numbers, and it's maybe helpful to just have a general idea. The best way to get these numbers into your day is to have a variety in the food choices that you're eating. And again, like I said, we've got meal plans that we show people, hey, what does a day look like for you, for your needs? What would a day actually look like? And then some people may need to focus a little bit more on vitamin D or focus a little bit more on calcium. So maybe we would kind of target those areas for you. Supplements may be coming up, thoughts in your head. Do I need one? How do I, meet my needs without it? What if I'm vegetarian? What if I'm vegan? Yes, some people do need additional supplemental support. I usually let a healthcare provider in the form of a primary care physician, and then we have clinicians on board at Lifestyle really be kind of the front runner of that conversation. Whereas I'm kind of talking a lot about more dietary sources and other lifestyle changes, but here to support and recommend and, talk through some of those concerns regarding, hey, do I need a supplement? How do I figure that out? That's something that I can help people with. Vitamin K. So maybe you've not heard about vitamin K and its role in bone health. Maybe we hear about calcium and vitamin D, but you're sitting there like, I've never heard about vitamin K being important. So usually I will recommend, if there is a vitamin D3 supplement that is recommended for you, and a lot of our clinicians would agree with this, that there have a little bit of vitamin K as well. It really helps to absorb that vitamin D. It also plays a role in bone metabolism and helps with calcium regulation, specifically, is what it's doing. Magnesium. Magnesium is extremely important for lots of different reasons, but it definitely has a role with your bone health, supporting bone structure, influences your calcium metabolism. Magnesium is a mineral that we don't get very regularly in our diet without focus. So that would be an area that I would kind of focus on with people And we'll talk about dietary sources here in a second. Supplementation is something that I sometimes really do encourage for people when it comes to magnesium. So again, it's a lot to cover in a day in a 30-minute presentation here, guys. But, I really encourage you, if this is something that you've been thinking about, or you feel as we're talking through this, I really need to learn more, that you reach out so that we can help facilitate that learning for you. Phosphorus. So phosphorus is an essential mineral found in bones and teeth. So naturally, it's going to be really helpful in the health of both of those things. It works in conjunction with calcium for overall bone health. And potassium. So this is a mineral that helps neutralize acids that can lead to bone breakdown and calcium loss. So again, guys, it's a lot of information. I usually, I kind of float back and forth with, should I put all this information here? But I do think it's kind of helpful for you to know what these vitamins and minerals are doing when it comes to your bone, joint, muscular health. Okay. So let's talk about some food sources. So when we think calcium, I know the first thing we typically think of is dairy products. Don't worry, you're able to get your calcium in without consuming dairy. You may be a candidate for supplementation, maybe not. It just depends on what other dietary sources you're focusing in on that are calcium rich. Today with my smoothie, I'm going to be featuring an almond milk, which is extremely high in calcium and a fantastic source, providing almost a third of your daily needs, depending on where you are in your phase of life with your calcium needs. So yeah, there's certainly ways of meeting needs with calcium without eating dairy. So just wanted to throw that out there. However, milk, cheese, yogurt, of course, is going to be good sources. Leafy green vegetables, kale and spinach specifically, almonds, such as an almond milk that I'm using today, and then for the fortified plant-based milks. Vitamin D. So maybe you guys have heard one of your bigger sources here of vitamin D is sunlight exposure. And really all you need is about 15 minutes of sunlight. Sure, as the seasons change and, sunlight gets less frequent, especially certain parts of the world, certain parts, where we're not seeing as much of that total sunlight, maybe supplementation would be ideal. However, there's other ways of getting that vitamin D in. Fatty fish, fortified foods is a big way of getting in vitamin D. It can be hard to meet your vitamin D needs through food alone. So this would be another area that if you're struggling with your bone health, this would be supplementation worthy as well. Vitamin K. So you're going to see vitamin K found in leafy greens, broccoli, Brussels sprouts. You'll see a big picture of foods there to the right. Again, it's really about having a combination and variety of good protein, lots of different variety in our fruits and vegetables, healthy fats. When we're focusing in on this is what we like to teach people how to do. You're really kind of covering a lot of these vitamin and mineral needs. So that's, something that just want to emphasize that a little bit. It's, you probably are doing just fine, but I think, sometimes it's nice to kind of focus in on this specifically and learn more. Okay, so phosphorus, you're going to find that mostly in dairy products, salmon, meat, legumes, which are beans, and whole grains. Potassium, so this would be coming from lots of fruits, mostly, some veggies, but avocado, bananas, tomatoes, milk, and salmon are going to be some of your top contenders there. And then magnesium. So nuts and seeds are going to be really the bigger source of magnesium, whole grains also, and then a little from some of your green leafy vegetables. All right, guys, so let's move into some of those macronutrients that we want to focus on. We talked about vitamins and minerals. Now we're going to talk about macronutrients. So those are going to be your protein sources, carbohydrate sources, and fat sources. So protein, very important. I know we hear about protein a lot for maybe other reasons. We need it to feel satiated or full, but adequate protein intake is definitely responsible for supporting bone health, maintaining bone mass and strength. Obviously, boosting that lean muscle mass is something that is going to be very protective to your bone and your skeletal system. And so having enough, just eating protein alone, I know we're going to talk about physical activity here, of course, too, but just eating protein alone helps that. So good sources, again, lean meats, yes, but we can get lots of protein from different plant-based sources. Fish, eggs, legumes, tofu, tempeh, nuts and seeds, your dairy products. Yes, protein powder is always an option. We talk about that a lot. Collagen protein is something that I'm going to be featuring today. And so if you've not heard about collagen protein, or you're kind of curious as to, hey, what's different about collagen protein than actual regular protein from, let's say, just eating lean meat or having some fish or eggs. So collagen protein just by itself is an incomplete protein. So we can't just, which having other sources of protein involved throughout your day is going to be just fine. But sometimes it's good to know a protein powder is going to be more of a complete protein. Collagen protein is incomplete. This is going to be collagen specifically is protein found within bones, skin, ligaments, muscles of animals. And it's something that when we're ingesting and eating, we're kind of doing good for all of those things. So collagen is really helpful for skin, for hair, for bones, for muscle, for joints. Really helpful, if you're suffering from joint pain and things like that, to incorporate collagen protein a little bit more. Not a magic fix here, of course, but it's a great way of supplementing something naturally and giving you additional protein at the same time. So we'll be featuring that today as well in the smoothie that I'm making. Omega-3 fatty acids. So moving on to more of the fat macronutrient. So omega-3s specifically help to reduce inflammation and can support joint health in that way. So supplementation is certainly an option for individuals who feel like it's really hard to get their omega-3s in without. So fatty fish, salmon, mackerel, these are, some of your top choices. And sometimes people just can't get behind eating fish, and I understand that. So some of your plant-based options would be flax seeds, chia seeds, walnuts, but sometimes people find they just need a little bit additional. So that is something that we might talk with people about, is taking something like an omega-3 supplementation. And then antioxidants. So antioxidants are found in lots of fruits and vegetables, nuts, seeds. These are things that are going to be anti-inflammatory, reduce stress, oxidative stress, inflammation, that in turn can affect joint health. So lots of sources from this particular group would be more of your fruits and your vegetables. Specifically, berries are very important just because they do have a lot of antioxidant benefit there. Vegetables, when you look at your red, your blue hues, these are going to really be more powerful. So that's something to kind of keep in mind also. And then nuts and seeds as well, just getting in some of those healthy fats, which those omega-3 fats, again, also so important to focus on. All right, guys, we are going to move out of the diet world here, and we are going to talk about physical activity's role, because this has such an important role in your bone and joint health. What I find most common, I would say, is when people come and see me, not a lot of people are doing weight-bearing exercises or strength training. And this is something that we as a whole at Lifestyle really do like to work with people on, no matter what age. There's a way for you to incorporate exercises that work for you. Yes, I do agree that maybe not everyone can do the same thing. We have to take into consideration modifications to exercises and any limitations that you have, which we would do. But I do highly recommend that you guys have some weight bearing / strength training exercises in your week, at least 2 times a week. And you can start small. Usually people that are really good at walking all of the time, I might say, hey, let's just slap on some wrist weights for that walk for 15, 20 minutes. So little things like that can kind of slowly build. And that's what I think is really fun for people to watch for themselves. But I also like to watch that with them as well. You know, maybe they start off with wrist weights and then all of a sudden, hey, 6 months later, they're in the gym, they've developed a strength training routine. Maybe they're taking some strength training classes. There could be lots of things that happen as a result of just starting from that one little small place. But specifically, weight-bearing exercises cause muscles and tendons to apply pressure to your bones. This helps to stimulate the bones to produce more bone tissue. I just find it very interesting to understand the why and what's happening. So when we think of weight-bearing exercises, this does not have to mean lifting a weight, okay? It means you're supporting your own weight and you're doing movement with your body. It could be a lot of body weight exercises, resistance bands, jumping rope, just playing sports, you know, going out there and, you know, play some pickleball, get out there and, you know, sign up for a 5K and walk with some buddies, you know, doing things that are something that maybe you kind of look forward to. I think getting together with groups of individuals is really motivating. So I usually recommend that for people versus just trying to do it at home alone. Not as fun. So I wouldn't recommend doing that all of the time if you're not really into this. But yeah, just going for a walk, a hike, taking the stairs instead of the elevator, just practicing some sit to stand. You know, these are things that we work with people on, kind of starting where you're at and working your way up. Strength training exercises specifically would be lifting weights or using resistance bands. This helps to, of course, build lean muscle mass. And strengthening those muscles is going to help strengthen those muscles around your joints. It's going to help with joint pain. It's going to help with more stability. There's lots of other things that can be beneficial with strength training and adequate protein, as far as metabolism boosts and things like that. But this is really what I like to focus with people on as far as why exercise is so important. And then something that I might see people that are really into strength training, but we don't do any stretching. And then I find people that love to stretch that don't do strength training. So we're just trying to bring it all together. So flexibility and mobility exercises are very important. They help to improve your balance, your flexibility, and in turn, this helps to reduce the risk of falls. I don't know if you guys, I'm going to take it way back here for a second, but if you remember, I talked about blue zones towards the beginning of the year, and I brought up Okinawa, and one of their bigger strengths from that particular blue zone is the fact that they have less falls, which is so important. And the reason they have less falls is because they do so much sit to stand all of the time because they don't have a lot of furniture. Isn't that so interesting? So practicing some of these things, just sitting down and getting up, and honestly start from a coffee table that's more supported and not so low to the ground, or a chair, something like that, where you're literally just sitting and standing and sitting and standing. And resistance bands are great. We've got lots of different resistance bands exercises that we can help you with, YouTube channels that you can go take a peek at. You can keep things like this in your office depending on where you work, and obviously if that works for you and your space. But I really encourage people to think outside of the box with some of this stuff. And we like to help people with that. Okay. Other lifestyle factors. So we've talked about diet, we've talked about exercise. So just in general though, when we're talking about lifestyle here, Weight management is an important factor to consider. That is something that just in general, maintaining a healthy weight can produce less stress on our weight-bearing joints, and it can lower the risk of conditions like osteoarthritis. Lots of other things to consider though as well. So posture, the way that we sit, these are things that I feel we just let go. We're not really concerned about stuff like that. Good posture and ergonomic practices, the way that we sit in a chair, the way that we, I love hearing people's stories about how they just maybe got a standing desk, or maybe they sit on a stability ball if that's possible. Not everything is going to work well for everyone, but maybe there's something out there that you could do a little differently. I have some lower back issues at times. I have a supportive back posture pillow that I sit with. That makes a huge difference. It just stays in the chair that I work in. Little things like that just can maybe go a long way. But preventing that joint strain and discomfort is going to help with, continuing your increased range of motion, continuing your ability to, have physical activity in your life. And that's always a good thing. So smoking and alcohol are definitely going to play a role in some of this. So I did want to include that. Smoking can reduce bone density, and it can increase your fracture risk. And alcohol in excess, this doesn't mean, the occasional glass of wine or an alcoholic beverage here and there, but in excess can interfere with your calcium absorption and your bone health as well. Hydration is so important. And so we focus on water a lot with people. And this is just, like all of it is really good for lots of reasons. Hydration is good for lots of different reasons, but proper hydration helps specifically with joint lubrication. So, again, less lubrication in our joints is going to cause pain. So these are things that we have to keep in mind. And like I mentioned just a minute ago, regular checkups, I cannot emphasize this enough. That's one thing that I love about our program, is the fact that we do have a healthcare provider, a clinician that's a PA or a nurse practitioner involved, so that they can be a great advocate, another source of information for you to talk about more medical related issues. Catch something, right? Like just talking with someone, sometimes we can catch things that we say, hey, I think you should bring that up to your primary care and see what they think. Maybe there's a test, maybe there's something that they could look into. So some of the tests and things that they do to monitor your bone density and your joint health, they have bone density tests and scans, which is the image that you see here, where, they're looking to see exactly what's going on if you are, in the beginning stages of some of those conditions that I mentioned there at the beginning. Obviously, things like x-rays, maybe we're looking at something called a CBC. Anytime you get lab work done, they're going to probably look at that with your primary care and your annual visit. It's called a complete blood count, and it can show things like arthritis, if that's starting to occur. Just a general physical exam, range of motion testing, flexibility testing. These are things that doctors can do, and, but you do have to advocate for yourself here. You have to, and keep in mind that these preventative visits are really important, and sometimes we think, hey, nothing's wrong, so why go, but going annually, maybe that could be that initial, hey, we're picking up on this, we're catching this, we think you should work on this, or we need to look into this further. Lots of resources here today, guys, lots of information. So I know sometimes, these presentations are tips and tricks, right? And then sometimes these presentations are, whoa, that was a decent amount of information I've not heard of before. So I think there's benefits to both of those styles. So today I did want to, of course, provide you with lots of different articles and resources that you can go back and read if you're into that kind of thing. Okay, so I want to thank you guys. I am going to now move into the cooking demonstration side of things. And today we are going to be doing an almond butter and banana protein smoothie. So I'm really excited to feature this. Any questions as I'm moving into the demo?
Yes,
Okay.
we had a few questions about collagen peptides.
Sure.
What should we be looking for as far as ingredients, and how do you know if it's a
Yeah.
good source? And is there any advantage to plain versus flavored, or does
Yeah.
that make a
So
difference?
I'll share what I'm using today. So this is, I honestly, guys, looked at this one because it was a little cheaper. So the Vitals protein that I put up, I think it was in my presentation, was a little bit more expensive. So this Simple Truth brand, you can get Harris Teeter. So unflavored is usually what I recommend. A lot of times with more of your flavors, unless you look at it and you can tell there's so many different collagen peptides out there, and I don't know every one of their brands. But yeah, I would just look at total sugar. That's something that you want to consider when you're looking at a flavor. It may be sweetened kind of not artificially, but an alternative sweetener like monk fruit or stevia, which is fine. So some of the other things that you're kind of looking for, there's definitely going to be a good amount of protein in there. So most of them have about 20 grams per serving. So, but yeah, I think the biggest thing is just making sure there's not a lot of added sugars coming from them. But there's lots of different brands out there. Again, this is the one I'm featuring. Simple Truth is the brand name. And I usually go for unflavored.
Perfect. Thank you.
This is going to be pretty simple, but I think simple is good. I'm not sure if you guys like doing smoothies, but this smoothie has such a fall inspired flavor to it. So I really want you to try it because it's really tasty. It is going to feature a frozen banana. I'm going to go grab my almond milk really quickly and pour some almond milk because that's what it's using as an unsweetened almond milk. I'm going to go ahead and kind of talk almond milk for a second because I know there's a lot of buzz going on. Is almond milk good? What about all the added ingredients? Kind of like um, with the collagen protein that was just mentioned. So yes, there are some almond milks that are certainly less processed than others. I think we all kind of have to play this. Do I need to worry about expense? Is that something that, I need to check out? You can of course make it at home. Are we going to do that? Maybe, but maybe some people don't want to do that. Califia is one of those brands, and I don't have a picture of it, but I should have put it as I'm thinking about it. That could have been something nice to put into the presentation. That is a brand that's pretty popular that you'll see in most grocery stores, and it's very little processing there, not a lot of added emulsifiers, ingredients, no added sugars, things like that. I usually look for unsweetened just because I don't think that you need to get added sugar from your milk. I think we can add it naturally from fruit and from other, which I'm going to feature another source of sweetener today that is just added, no added sugars. So I'm going to talk about that. Orgain actually has an almond milk that has a little protein to it. I know that sometimes people kind of think, oh, almond milk isn't as good because it doesn't have protein. However, if you're adding protein to it like we're doing today, then that kind of takes care of that. Yeah, definitely going unsweetened. And carrageenan is that ingredient that's an emulsifier in almond milk to help. Some of these things are helping with shelf life, helping with thickening, helping with things like that. So I would say if you have any gut health issues, to definitely make sure that ingredient is not in your almond milk. And that Califia brand that I mentioned does not have that in there. So just a couple of things to mention off the bat. And if you have any more questions about almond milk, you can throw them my way. So the first thing that I like to do when I'm making a smoothie is add the liquid. All right. I don't have a ton of frozen. I've got some frozen banana here. One frozen banana. So I'm going to start with the liquid and then I'm going to add my banana. The other thing that's really great about this smoothie is that it has a lovely macronutrient balance. So if you're sitting here wondering, I don't know if I can do a smoothie with banana, I have, diabetes, or I'm worried about sugar. So this particular smoothie has pretty solid almost 1-to-1. It's not completely, but there's over 20 grams of protein, 22 grams of fat, and around 30 35-ish grams of carbohydrate. Okay, so, all right. So first thing I'm going to do, blenders. I was going to talk about blenders for a second because I didn't know if anyone would have questions about that. So I have the Ninja here. I've had it for 10 years. I'm sure there's been 5, 7, 20 models come out since then. I'm not sure. I think there are lots of options out there that are affordable. So I think that that's really important. And I think it's important to know how much you're going to use it and what you're going to be using it for. I also am not featuring it today. You do have to make sure they're charged, but the blend jets are kind of fun and they're portable and you can take them with you. I got this for 35 at Target. So I felt that was pretty good. They can originally they're 50. So that's what I'm using today to make this smoothie is my Ninja. All right. Okay. Okay, so that was 1 cup of unsweetened almond milk. All right. You can add a little bit more. I felt like it would be okay if you added 10 ounces versus 8 ounces, or, just a touch more to get in a little bit more liquid if you like it to, have a bit more volume. But I just kind of stuck with what it recommended. And then I am going to I chop up bananas and freeze them in little Ziploc bags all of the time. So I definitely recommend that because it's quick. So I'm going to add my frozen-ish banana. And then I'm going to add 2 tablespoons of almond butter. So that's where you're going to get your healthy fats. You can add another nut butter if you'd like to, but if you like almond butter, I really think that the flavors go well with this recipe. I am going to add the collagen peptides now for the protein. So 2 scoops is a serving. I'm going to do about a scoop and a half. So it should be somewhere around 15-ish grams of protein. Could add the whole second serving if you wanted to. All right, I'm adding half a teaspoon of cinnamon. This is such a nice touch. The cinnamon to it gives it that fall flavor for sure. So half a teaspoon of cinnamon. I wanted to talk about the date syrup really quickly. I don't know if you guys have ever had date syrup. So similar to honey, but this is no added sugar since it's just coming from dates. All I'm using, it's not a lot, you do not need a lot, is a teaspoon. So a tablespoon is a serving, which is 13 grams of sugar, but I'm only using a third of that. Okay. So 54 calories for a tablespoon. Again, only using a third of that. And it gives it just enough. You may try this and think, hey, I don't really need anything else to sweeten it. To me, just the small frozen banana is perfectly fine. To me, I thought it needed just a little touch, but yeah. And then I thought it could be fun to feature this because, and this lasts a long, long time. But it's nice to find something. I use honey and maple syrup and things like that occasionally, but this being no added sugars is kind of a nice way of sweetening things. So I'm going to do a teaspoon into the smoothie. All right, guys, I'm just going to blend this up really quickly. Any questions as I'm kind of preparing to do
that? Yes, we did have somebody ask about B12. Is that also helpful for bone and joint?
B12 is not something that I'm thinking of off the top of my head as something that, is emphasized too much. But, again, I think a variety of foods and things like that in your diet, you're going to ensure you're getting enough B12, but that might be kind of a separate conversation to understand, maybe why that feels like it's a concern, but it's not something that's popping up for me as I'm standing right here thinking through it. No.
Okay.
All right, guys, I'm going to blend this up really quickly, and then I definitely have time to take some more questions if you guys have them.
Okay. Katie, if we don't eat any fish, should we be looking for a collagen powder with marine collagen in it?
Um, Another good question. I mean, this is bovine collagen, which is not marine. So I mean, there could be both. There's no recommendation. I don't have a specific recommendation about that particularly. So it's not something that I'm using. So I don't think that's an issue either. Would be fine.
And do you have any thoughts on what the difference between collagen peptides and regular, like liquid collagen? Is it that the liquid has biotin in it, or?
These are very specific collagen questions. I might have to look that one up. I'm so sorry. I
Okay,
don't
that's
know.
okay.
Very, very good detailed questions though. Yeah.
Okay, great. Thank you.
I'm going to grab a cup real quick and pour this smoothie out, okay? Okay, guys. So this is so delicious. I don't want to dip it too much and then you not hear me. Decent amount, of liquid. You could sprinkle it a little bit more with cinnamon. How I would, have this is maybe as a breakfast in the morning. Sometimes it's kind of nice. You can make it swing to work, drink it in the car on your way to work, have it once you get there. There really is not a lot of ingredients that you need in order to do this. I just would have some preparation involved, like freezing the bananas, ahead of time. And yeah, so it's really tasty though. Again, I say this a lot. I'm always like, oh, I wish you guys could just try it. You'll have to make this one at home because it's really, really, really good.
Talking about smoothies, this person said that they have heard that they must be made with fruits and vegetables for a balanced diet. And that's not the case in what we're making today. So do you want to speak to the different varieties of smoothies?
Sure. There's certainly ways of having variety with your smoothies. Um, why can't we eat fruits and vegetables throughout our day otherwise, right? Like there's ways of having different smoothies that don't always have fruits and vegetables in them in order for them to be healthy. This being an example of that. So it definitely has banana, which is a fruit, has healthy fat from your almond butter. It's got a great source of protein and not a lot of added sugars, none actually. So that checks a lot of boxes for me. A lot of times when we go places like Smoothie King or, tropical smoothie, right? And they load protein and they put fruits and sometimes vegetables in theirs, but tons of juice and other ingredients. So to me, that has fruits and veggies, but isn't, in my opinion, the most healthy option. So yes, I think there are lots of different recipes out there that you might throw a handful of spinach in, or maybe we're, adding some other type of veggie in to kind of grasp a little bit more micronutrients. But just because we're not having it in that smoothie doesn't mean we're not going to be able to obtain those nutrients throughout the rest of our day. So good question though, because I know that is, something that I think we're thinking about a lot is smoothies can sometimes just not have everything that we feel it should have. But yeah, no need to worry, you guys. This is a really, really healthy option for a smoothie. And like I said, a great addition for fun fall flavors to try.
Smoothie, would this smoothie be a good breakfast?
Yeah.
Okay.
Yeah, definitely. I think I mentioned that. It's a great way to start your day because it does have so much balance to it. It has a decent amount of protein. It has a decent amount of fat. That's where we can really kind of get thrown off sometimes with smoothies and their ability to keep us full, is the fact that there's not a lot of fat involved. So I always encourage frozen avocado, adding in some nut butter, something like that to, help provide some of that additional support to help you stay full longer, because smoothies sometimes, because we're not chewing them, doesn't really kind of stay with us as long. So yeah, great way to start your day.
All right.
All right, guys. Well, if you don't have any more questions, thank you so much for this, opportunity to talk to you guys today. And I'm really looking forward to seeing you guys next time.